Okay, so I have all my forms here for admitting a patient for surgery today. And then my first one is going to be an admittance form, which is just kind of like, this is our surgery form right here. And it's just a rundown of letting them know about blood work, IV, microchip, if they, have any baby teeth they want pulled, or if we're doing a dental. Today we're doing a spay. So we will ask her, because she's a puppy, if she has any puppy teeth, if she wants us to pull them. And then it's just kind of some other info about pain meds that they'll go home on. And then they, of course, will sign at the bottom. And I have above here my permanent patient records. She's only been coming here since February because she's a puppy. And it's going to show here. She's canine. She's an English bulldog. It's going to have her markings white and tan. And her birthday is February 4th. And it has her name, owner's name, and the last name. And then all her records here from her puppy appointments, all on the back page. Any lab results, which we haven't done on her yet. Surgery forms, boarding forms, and then medical history, which we have one from the surgical center because she went there. And so the release form is going to be on these two also. These are combined. This is our anesthetic form. It's just a sedation authorization also. Just kind of stating for the owner that they understand that with any sedation or anesthetic procedure that there's also a risk of bodily injury or death, and we kind of give them a rundown of how we use SIVO, and we have them hooked up to the ECG, and we monitor them. And then at the bottom is just saying that they have full financial responsibility, and that's where they sign and date for that. And then I have my cage cards, so we'll put this on her when she comes in, and then we'll put this on her cage. And this little box is just where we're going to keep her belongings. So these are all of the stuff that we need to admit her whenever she comes in, and we'll have several signatures and phone numbers. And whenever that we do a discharge, this will be a part of it. We'll go over all the pain meds that they will need to take it home. And we're going to go over, for a spay, we'll go over, so for a spay, we'll go over no bathing for about 10 days, making sure she's not jumping on furniture and jumping off her, just kind of keep her calm for a few days, having them watch for any signs of infection, swelling at the side, any discharge coming out, making sure that she's not messing with it. And of course, we don't usually send a cone home, but we can if they think she's going to mess with it. And I also like to have the importance of also watching the catheter site too, because some dogs and cats will go for that area. And then just letting them know with the pain meds, the running down of directions with that, making sure that they're giving food, that they'll probably be groggy tonight, and they can eat if they want, but they might just want to go home and sleep. And then just kind of watching over the next few days any signs of her not doing right, being even more lethargic, any vomiting, any diarrhea, if they're not eating by the next day, just any kind of complications that they might want to call us for. Just the main thing is no bathing and, kind of restricted activity for a few days. So I have an example here of our lab forms. You basically will enter in doctor, client, all this information up here about the pet, and then you would just kind of check what you need. So you can do anything from a thyroid panel, bile acid, urine culture, if you want to send off urinalysis, and then you would send off the top part to the lab, and then the bottom part you would keep for your records. And of course, depending on what kind of lab you're requesting, it may take next day or a couple of days to do it. And this is just an example of our lab forms. Show you some restraints for blood draws. So whenever you're holding a dog for jugular, you want to make sure you're holding his head and keeping his head straight ahead so they have access to the vein here. And then for whenever they want the, okay, we'll turn this way. For a cephalic, you'll hold, and then you're gonna hold the leg and you'll hold off and then twist, and then you can see the vein right here, and make sure you have restraint of the head also, because they're trusting you to make sure that, you know, if he flinches or anything, that you've got a good grip on him. Okay, so holding off for the saphenous vein on a dog, we're going to be on the lateral side, so we're just going to kind of squeeze and apply pressure, and then the other tech drawing blood will hold, and you can see the vein right here. And then, of course, whenever they're done, you'll just let up. So today I'm going to show you how to properly move a dog in and out of a cage. So we're going to open it, and I'm going to want to kind of slide my hand in, just in case if they're jumpers. And I want to pull him out, holding kind of. So when I put my friend here back in a cage, I'm going to open it and slide it in, and I want to kind of hold my hand on them until I close it all the way. Okay, so applying a muzzle, we want to make sure we pull this out so that we're not struggling to pull it out while it's on the dog. So we're just going to slip it and clip it, and then now we can tighten. I know. And make sure that it's tight, and so he doesn't have room to open his mouth. But he can still breathe, he can still lick, and then whenever you're done, just pop it. And I always like to pull it out to have it ready for the next dog. Our e-collar, what we're going to do is we'll put it on his big head. And usually if they have a collar, you can loop these through the collar, but for him, you also can do it this way too. It's just some gauze, and then you can just tighten this on, but most of the time you can loop these through the collar. And then this one has been cut down a little bit, but he can still eat his food without it being longer out, but he won't be able to really get to anything else. And there's different sizes, and you can measure those on them whenever they're here for surgery and whatnot. So today I have Sweetness, and I'm going to show you a physical exam on a dog, just kind of the basic stuff. What we usually do first is get a weight, and then we're going to get a temperature. And so I have my thermometer, have some lube on the end of it. And the temperatures, usually we try to use the 8-second ones to go faster. And this shows his temperature is 100.8. And dogs usually range about 99 to 102, 103, so he's in the normal range. And I'm going to check his pulse. So what I'm going to do is on the inside, on the femoral artery, so I'm going to count for about 15 seconds. So I counted 40, and what I'm going to do, since I counted for 15 seconds, is multiply that by 4. Excuse me. So that'll give me 160, and that was his pulse rate. And now I will check his respiratory rate. So what I'm going to do is listen like I'm listening to his heartbeat, but I'm going to listen to the whooshing sound of his breaths. Alright, so I counted 10 in a 15-second period, so I'll divide that, or multiply that by 4, and so that will give me 40. And usually we also will check the eyes and the ears. And now I'll show the heart rate. You can sit, it's okay. Turn this way, okay. So for the heart rate, I'm just going to listen and count. Okay. So for the heart rate, I counted in a 15-second period, I counted 35, multiply 35 by 4, and that will end up giving me 140. So his heart rate is 140. And of course, when you listen, you also want to listen for any abnormalities like a heart murmur, because you always want to hear a do-do, do-do, do-do. And if you hear like a do, like a weird noise like that, it's usually a heart murmur. And also in the lungs, if you don't hear any like normal like noise like that, if you hear like crackling, usually there's something going on in the lungs with fluid buildup, and that's when you, of course, the doctor will put them on medications for that. Usually the heart murmur can contribute, heart disease can contribute to that too. Okay, so we're going to do the physical exam on the cat. So first we're going to get our temperature. Okay, so the temperature is 98.2. It is slightly low, but she is also sedated too. And so now I'm going to, well, let me check her pulse first. So for the pulse, you have the mask on? Okay. I'll go inside her leg, where the, so inside the leg, there's the femoral artery, and you can just place your hand on that, and that's how you'll count your pulse. And then I will listen to her respiratory rate. And for this, I'm going to go to listen like I'm listening to the heart, but I'm actually going to be listening to the breathing sounds and counting those. So she took 3 breaths in a 15-second time frame, and it's, you know, she is on the mask, and normally it would be higher than that. And then, so now I'm going to listen to her heart rate, and I want to be able, a normal heart rate would be like a thud thud. If it's makes any other kind of off noises, there's usually means there's a heart murmur. So now I'm going to listen to the heart rate. Okay, so I got 25 beats in a 15-second window. So that I'll just times that by 4, and that would be my beats per minute. And of course it is going to be a little bit slower because she is sedated. And there's just different angles whenever you're listening to the heart. You usually do want to listen on both sides and then kind of in different areas too. Excuse me. And then so for her, we have 100 beats, so that would be 100 beats a minute, and then it would be 12 for the respiratory rate. And that is our condensed well exam on the cat. Okay, so I will be drawing blood from the cephalic vein. I know, sweetie. Ready? So she's going to hold off.
Looks like it.
Got her? I know, baby. I know. Sorry, I moved that. That was my fault.
You may be too shallow.
Deeper? Okay. Okay. Today we'll be doing a jugular blood draw on a dog, Ruby Rose. So to hold off, I'm going to want to hold where this bone is.
Good girl.
I know, it's okay, it's okay.
I know.
All right.
Good girl.
And then my other tech will hold off. And that's getting blood from a dog. Okay, so I'm going to be drawing blood from the saphenous vein.
Sure.
All right, and there you go.
You're almost there. There you go. Now lift up your index finger here.
It's just slowly.
You're probably right on the edge.
Yeah.
That's also the one we drew blood out of earlier, so you may have a lot of clotted stuff in the way.
Okay. Okay. So I'll doing a cephalic blood draw. So we're going to draw blood from our feline friend here. I'm just going to put some alcohol on it to help flatten so I can see my vein better. Okay, so, and he's holding off for me so I can feel my vein right here. And there's the blood draw. I want to make sure I hold off afterwards too. So today I'm just going to discuss minimum databases, and I'm just going to kind of use one of our recent patients as an example. We did a minimum database on him, and we had a lot of low things going on with calcium, globulin, and this kind of let my doctor know what our next step was going to be. He came in for vomiting and diarrhea, and so this is what we ran on him. And we also did a CPO, which ended up being abnormal, and that kind of coincides with the amylase. But there was just some other things that were off. So we needed additional databases and tests because of the abnormalities. So this included, well, one of the additional tests was the canine pancreatitis lipase test, which was abnormal. Because he had diarrhea, we also sent off for a Giardia test just to see if that was something that was going on. And just get my papers here. We also, he ended up coming back because if you can see on the notes, my doctor's recommendations were bile acid UA to start. We ended up sending off for our additional test was a bile acid test. And so this is all of our stuff that we got back here. We also did urine. We did a urinalysis in-house, as well as sending it off. And this is just an example of starting when you have a sick patient, starting here, and then just kind of putting pieces together on what the next step will be. And then, of course, after the bile acid and the UA, we afterwards ended up putting him on doxycycline and benazepril. So today I'm just going to discuss the appropriate anesthetic and peri-anesthetic protocol for pain management and what we use for a procedure like the pre-med. And I know in the notes it says we usually don't do this. We have a form and everything that the doctor, of course, fills out by weight. But since, like it says, I'll be administering them, we use, in the book, it's referred to as BAG. So we do Torb, Glyco, and ACE. And we use the Glyco, and it helps with... it helps for if they have excess saliva, and excuse me, it also helps to prevent bradycardia. And then we use Torb for sedation, and then we use ACE, and ACE is good for inducing the sedation also, and it also has a long duration, and it doesn't affect the respiratory very much, and it also has little for the cardiac depression. And then for the second part, for the tubing, we use propofol, and that is good with inducing just kind of a state of general anesthesia, and that is pretty quick. It hits, I think, like 30 to 60 seconds, and then it usually lasts for about 2 to 5 minutes, and that's the time where we intubate. And then for our anesthetic gas that we use is sevoflurane, and that's really good because it has a rapid induction and recovery, and then it's just the better one on the market. And I know it's also kind of ranks up there with isoflurane too, and that's what we use for ours also. And just kind of a quick peek, this is where we would put the weight in, and so it just kind of puts everything here for us: glyco, butorphanol, ACE, and then the propofol, and of course morphine if the procedure calls for it, and then penicillin if the procedure calls for it, and buprenorphine also, one of those if the procedure calls for it. So it's just all laid out right here. So today we are entering into the controlled substance log. I've already entered in the 2 surgeries. What we do is we put the owner's last name and the patient's name. So these are the pet's names, and these are the 2 that we did today on the 12th. The amount used, and then we would subtract that from the previous balance, and then of course we would initial it. So this is our anesthetic machine, and some of the parts on it, this is our pressure meter, and this is gonna let us know the pressure in the patient's lungs. And this is the vaporizer. So this contains our sevoflurane, and this is gonna take it into a liquid form and turn it into a gas to pump it through to the patient. And these are our flutter valves. This is the inhalation, exhalation, and this is our reservoir bag. The bag expands and contracts with the patient's breathing, and this also allows us kind of a way to monitor their breathing because we'll see it inflate. This is the scavenger container, and this is where all the excess gas goes after the patient inhales and exhales. And this is our pop-off valve. This allows excess gas to exit the anesthetic circuit and then enter into the scavenger. This is the soda lime. This will turn purple when it's ready to change. And then also this contains the carbon dioxide and water vapor that comes out of the patient. This is the oxygen flush valve. If you turn it up, it'll fill the bag, and it'll also allow a lot of oxygen to be kind of rushed to a very ill patient. Usually whenever you disconnect the hoses, you can also use this to flush out any gas that's still kind of left lingering. This is the oxygen flow meter, and this just kind of regulates, when you turn it up, the ball will usually go up, and it'll regulate how much oxygen is getting to the patient, and that's determined size, and then using rebreather versus non-rebreather. So here we have two, these are the circular breathing systems or the rebreathing systems. So with these, some of the gas is pumped back to the patient, but no CO2. And so this is our non-rebreathing, and there's the open and close valve, and we have a reservoir bag on it. With this, there's very little to no gas that is sent back to the patient, and there's less air movement with this one too. And then in here we have several different size masks. This is when you need to or just want to give oxygen to a patient, or if you have to do kind of like mask them down. Sometimes we use this with cats because they're usually not friendly, and we have very teeny tiny ones. And then several big ones. And this is our induction chamber. So for this, you would put your animal in, most of the time a cat, or ferret. And there's a divider here for smaller mice, gerbils, hedgehogs. And this is going to go up to your scavenger, and this is going to hook up to this part of your machine. And you'll usually pump oxygen in first for a little bit, and then you'll turn your Sevo on. So today I'm going to do a leak test on the machine, and I have my bag here. Let me flatten that. So I'm just going to hold this to make sure no air gets through, and I have I'm just going to push my little oxygen. Ready? So I want to count to 10 seconds. And it doesn't look like my reservoir bag has deflated at all. And now I just let it go, so now it's deflating. But that is how you check for a leak on your machine. Okay, so I'm gonna place my temperature probe, and I'm just gonna get some lube here on the tip of it. And I have it right here in this area. Of course, right now it's showing about room air. So I'm just gonna slide this in. And then you see the temperature is going up. All right, and then now I'm gonna put my ECG. So these are all labeled. This is gonna be the left leg, right arm, and left arm. I'm gonna put some lube on these because it seems to work really good. Put this on my left arm here. And this is gonna go on my left leg. Here. And there's several different spots you can put them. You can also do on the point here and here. And this is going to be my right arm, which I'm going to slide right in under here. And so we've got the left and the right across from each other, and the third point down here, which is the left leg. And then our pulse ox we have placed on the tongue. And sometimes you might want to wet the tongue, because if it's too dry, or if you're not getting certain readings somewhere, we also have tried the ear. Okay, so I have my cuff, and for her she's going to be a 4. And whenever I wrap it, I want the index line to fall in between this area, and I want this to be close to the artery. Put this on here, and then hook to the machine. And so I have it on pretty tight, and now I'm going to hit the blood pressure button, and it's going to start reading. And so I can also print to have all this out in the patient's record with the temperature and heart rate and blood pressure. And then I have my my thermometer is not plugged in right now, but the 21 and the 20, that bouncing back and forth, is for my respiratory rate. And then I have my heart rate and my pulse ox, which I showed earlier was on the tongue. And then here's my blood pressure, 127/109. And then so this is all my monitoring station right here. So today I'm just going to go over the esophageal stethoscope, and unfortunately we have one on order because ours is not working. But the whole purpose of it is to be able to get a better listen of the heart and the lungs. So you would lube this end, and of course while your patient's under, and you would insert this very carefully alongside your tube. And then it's a stethoscope. So what you'll do is, while the patient's under, to be kind of out of the sterile field, you can insert this in and still be far enough away with this that you won't have to lift up the drape and be in the field while they're on the table. And you would just listen to the heart rate, and this is, and the lung sounds, and be able to get a clear view kind of out of the way. And if you want to be accurate too, this would be the best instrument for it. And like I said, I unfortunately can't actually demonstrate it because it's not, broke. And we are ordering one, but I can at least just give you a rundown of it. And if the dog is on the table here and you have the tube in, you can at least be over here kind of out of the way, listening to the heart rate and the lung sounds and making sure that everything is still good. And this is as accurate as you're going to get because you're actually going to be inside listening to it. Okay, so I'm going to measure the tube size for our patient Izzy today. So what I want to do is I want to measure here and make sure I can't see either side. And then I also am going to measure. You want to lay down? Go ahead. Okay, and then I will also measure this way. So whenever I put my tie on, I'll probably tie about right here. Okay, so today we're going to do a saphenous catheter. Okay, so I'm gonna shave my area first, and I have a nice area, and you can see the vein right here. And then I'm gonna scrub. And I'm going to alternate 3 the chlorhexidine, 3 alcohol.
Well, is he here? Okay, wait a minute. I'm getting a label.
And I have my assistant here holding the leg back, so I'm going to use a tourniquet. Make sure I put this on without touching the area. And I'm going to use a 24 gauge because in the cat they have very small veins. Okay, let me get my light good. All right. It's a very rolly vein. I'm going to put my cap on and then pop my tourniquet off. And leave that up there out of the way. So you can see I got a flash, so I advanced it forward and I put this on while I tape. And it's just going to be the same kind of tape job as a cephalic. And I don't want it to be too tight. Totally the hair. Okay. And now I'm going to put my plug on. tighten it. And then before I finish taping, I'm going to flush it to make sure I'm still in. And let's see if we can, if you watch the vein, you can see I'm in. And then my vet wrap last. And I want to put a finger here while I wrap it, so that when I let it go, it's not too tight. Alright, so there's my finished saphenous catheter. Okay, so today we're going to place a catheter, and we have our slightly sedated patient, Ruby Rose. So first we're going to shave. Get some of this hair out of the way. All right. And next we're gonna scrub. And we'll do 3 each. So we'll do 3 of the chlorhexidine scrub, and then 3 of the alcohol. Okay. So I'm just gonna kind of get everything open. And for her size, I'm going to be using a 22 gauge IV catheter, and I have all my tape and everything ready over here too. Alright, so my other tech is going to hold off for me.
Hello?
Yeah, Phoebe's here.
Thank you.
Okay.
It's gonna be just a minute.
Okay.
Just kind of late. Even Dr. Marr's like, sleep. Okay. So I see the vein. So I have my flash. And now I'm just going to advance. Alright, so now I'm going to get my first piece of tape and fold it back around. And I want to make sure I'm holding still my part and then on her part too, just in case if she jerks a little bit. I have my split tape here. I don't want it to be too tight. And now I have my plug. I want to make sure that's on tight and flush it before I finish taping. And you can see it moving through the vein. Get my last piece of tape to cross over the plug. And then my vet wrap, which I have a slit to go through here. And I want to put my finger to make sure that I'm not putting it on too tight. And that's the catheter. Okay, so today we're doing an IM injection, and what I'm going to do is feel for the muscle. So I have this kind of indentation here and then right here, so I'm going to go for this back one. And I'm going to pull out, make sure there's no blood, and inject. So we're going to do sub-Q. So what I'm going to do is I'm going to pinch the skin up and make like a little tent. And pull back. And there you go. Okay, so today we're going to give an IV injection. And I feel the vein because it's huge right here. So I want to pull back. And I get blood. And let me not drop it. I'm just going to inject. There you go. Okay, so now I'm going to video using propofol to put our surgery patient under all the way. And my doctor is here also monitoring. So I have my propofol and I have 8 cc's pulled up. So I'm just going to start slowly administering this into the IV. It's okay, catheter. Just a little bit at a time. Okay. I'm just gonna flush this.
He's scheduled for like 15, right?
Yeah. Good. Okay, so now I'm in a tube and I have a 9 with the tie on. I've lubed the end of it. So I'm going to check his jaw tone and then pull his tongue out. Yeah. Okay. And we attached them. Turn oxygen on. Sevo, inflating the cuff. And I want to inflate it to where it's not like taut, but squish a little. So this is good. And now I'm going to lube the eyes. And so we have Sevo on, oxygen on. And he still has a little bit of a blink, but we're gonna making sure we're in all the way. So now I'm going to palpate her bladder, and she does, just going to feel in this area, and she does feel like she has some urine in there, so I'm going to go ahead and express her bladder for her. Very, very slowly, kind of like massaging type movements. Now it just feels like there's just a tiny bit left in there, so I'm just going to squeeze that out, because moving her when she's waking up, we don't want her urinating. And I just want to be really gentle. Alright, I think that's the last bit of it. Okay, so now we're going to shave for our spay. And what we're going to do is we're going to do a clipper width from each area and then above the belly button. And we want to make sure that we're keeping an eye on the clippers and we're not letting them get too hot. And we want to try also to not cause any razor burn, especially in the area where the doctor will be cutting. Okay, so I've shaved a clipper width up and then up for the belly button, and then where he cuts, I made sure to get all the hairs around here. And then of course there's little, because of the hair on the dog, I am going to get the vacuum out and vacuum up these little stray hairs to make sure I get it all off of her. If you look on the side, like I'm going to vacuum all that up, and then we will start the scrub. Okay. Do my scrubs here. So I'm just going in, starting and then working my way out. Alright, so what I'm going to do now for the move is just to cover where I've already scrubbed. And then while I'm doing this too, I am also monitoring her with my portable pulse ox, so I can keep an eye on her vitals too while we're doing all this. So now we're going to transport her to the surgery suite. So once we move her over, we're going to tie her down into the surgery suite, and we got her hooked back up to the machine. And so now we're going to hook up our pulse ox and our ECG machine. We're going to hook that up, and then we'll also going to get the IV going. So right now I have my monitor sheet, and it does time, respiratory rate, heart rate, the mucous membranes, the capillary refill time, temperature, fluids, gas flow, and everything. And we usually do this about every 5 minutes. So every 5 minutes, I'm just going to make a note. Even though I have her hooked up to machines, I still want to be able to listen to the heart rate and see the mucous membranes and capillary refill time. So for right now, I'm just going to monitor all that. Okay, so I'm just going to go down my list here. So for my capillary refill time, I'm just going to check the gums. Turn pale, and then it looks like it's taking about 2 seconds for them to get back to their normal color. So I'm just going to put 2 seconds here. And then my fluid amount is 50. And my mucous membranes right now look pretty good, a nice pink color. So I'm just going to write pink in my space. And then now I'm just going to listen to her heart rate and her respiratory rate and take note of that too. And like I said, I do have her hooked up to machines, but you still want to monitor it on your own too. Okay, so for my heart rate, I'm getting about 115, which is along the lines of what my machine. Okay, for doing CPR, we're going to use my sedated small animal. And what you want to do is cup around the chest or rib cage area where the heart would be, and you want to pump, and you want to use your whole hand, not just your fingertips. And of course, I'm not going to demonstrate it, but I just wanted to show where you would hold. On a large animal, you would put your hands this area, and of course pump down. And every time you pump or squeeze, you want to do it hard and wait for everything to inflate back before you do it again. And so you would hold the cat here and use all of your hands to do it. Okay, so before I scrub, I'm going to use this blue that came in the scrub, and I'm going to clean out underneath my nails really good. And then I'll take my scrub and I will start with my nails. And then I want this whole process to be 10 minutes. So I'm going to scrub each finger like it has 4 sides. So I'll start. On each side. This side. Yes.
Have a mask on.
Oh, hey. So scrub the back,
for adding bats this week.
side,
Red bulldogs are somewhat large.
and then I'm going to work
I said we would use discretion.
my way all the way up to my elbow.
See, I'm not here till like 10:30 on Thursday. Because of school. Yeah, I think it's yeah, I thought that was super short area.
Okay. And then I'm going to do my other hand. So now whenever I rinse, I'm going to use my foot pedal. And I'm going to tilt to where the water runs off my arm. And then I'm just going to keep my hands up where all the water runs off. And I have all my stuff laid out and ready to go. So when I open, my pack is sterile. I have my strip showing that it's been autoclaved. So I'm going to take my Huck towel, shake it out, use this top part of the side to dry off my hands. And then I'm going to grab this part back here and dry this hand. Okay, so now I'm going to take my gown, grab it by these two strings, make sure I don't touch anything with it. Put my one arm on. Huh?
Tie first?
Yes, please. Okay, so I'm going to keep my hands in and I'm just going to slide my right hand.
Once you get started, your fingers can go and start advancing.
It's so tight.
Yeah, especially when your fingers caught in the ground.
Yep. Hold on, let me adjust myself. Okay.
Roll that down. Now that hand's freed up to hold the glove however you want to. For your non-dominant hand.
Dr. Pena wears these? Okay.
Or you were 6.5.
Oh.
Those are 6s.
Put this down.
Just get the bubbles out. No, start at the tips and slide them down.
Okay. Get all the bubbles out. And now I'm ready. Okay, so now I'm going to drape my patient now that I'm sterile. And I have all my stuff set out in a sterile area. So I'll take my first Huck towel. Okay. Okay, now once I got these all clamped in, I'm going to take my surgery drape and place it here. Okay, and pause. So I have my surgery pack over here, so I'm going to finish opening it all the way up. And I have my autoclave strip showing that it's been autoclaved. So now I'm going to finish clamping on my surgery drape. So that's all ready to go. And I'm going to get my blade ready. So I have my surgery blade facing away from me. And so this is all ready for the doctor now.
You want to block it for me?
Okay, so I'm going to use sterile gauze.
What do you need?
Yep, okay, so we're about to start on our cat neuter. So some duties and responsibilities of a sterile technician would be, while they're in the room and sterile, handing the doctor instruments the correct way, regular instruments and the scalpel blade and the handle. Also, any tissue handling, keeping them moist or blotting any area that's bleeding a lot and kind of causing a mess, and basically prepping the patient, draping the patient, having the surgery table set up and ready for the doctor. So if somebody becomes unsterile, like if anybody drops something on the ground, you can do flash sterilization, or if you have extra already sterilized instruments that you're using, if anybody touches something with the gown, they would just need to take the gown off and then put a sterile gown back on. Okay, prepping for cat spay. All right, we are doing a canine neuter today. Okay, I'm just videotaping myself in the room with a canine spay. Okay, so after we have a surgery, we're just gonna clean up. We have some baskets over here for surgery, and then just the towels. And gonna spray my table down with chlorhexidine and give that a good wipe down. The surgery trash will, of course, bag up and take out to the dumpster. we have our dirty instruments over here. Any needles or scalpels that we have, we put in the sharps container. The doctor actually likes to be the one that handles that. So we're just going to kind of straighten everything back up. I'm going to take this needle off. Sorry, I'm working one-handed here. This is going to go in the sharps container. That was for our fluids. And then I'm also going to take this off. So I want to make sure I wash this off. So I put the pole socks and the leads back away, and I'm just going to take my tubes off and my bag. And just store those away here. Put that right there. Just get my room prepped. I'm going to take this trash out. There are no needles or scalpels in here, so I'm going to put these with the other tools and throw the trash away, of course. Put these with the other tools and wash them. So I'm going to clean some instruments today, and I have it in my instruments. This is in the surgery room, and we put the instruments in here. This is the detergent powder. So I'll fill this and sprinkle powder in there. And of course, usually there's a lot more instruments than just these two. And I'm just going to let this sit for a little bit. So after they've been sitting here for a little bit, all I'm going to do at this point is take them out and scrub them. And then, of course, I've already started on some, so then I'll just lay them out to dry. And after they have dried, I have my surgical milk. And I just am going to lay them in here. And I'm going to submerge them. And they only need to hang out in here just for a few minutes, and then I'll let them back out and let them cool off. This is instrument milk is also a lubricant. Okay, so today we're going to wrap a surgery pack. I've already kind of laid out the instruments in order, just to kind of make the video go by a little quicker. So I'm going to face them to where this colored piece is away from me. And just get them stacked in order from tallest to shortest. See? And I put my spay hook, and I'm going to get my sterilization strip. I'm going to put them in the middle and lay them kind of flat. And I have my gauze, just enough that he'll need during surgery. And I'm going to put these on top. And now I'm going to wrap. So I'm going to pull the top, and I'm going to pull this down tight and pull it really tight and flip it this way, and then pull this side tight, flip it, pull the bottom, not too tight because you can rip the huck towel. And I'm gonna make a little flip here. Now I'm gonna work with my green, so I'm gonna pull the top down very tight, and I like to kind of hold this down tight, and I'm going to flip this and make several, and so I'm going to flip it and flip it forward again, and then again to make a little tab, just like this. Let me get a close look. Now pull this side. And you can see I've done it here too. So get a close-up look. So I'm going to tuck this, pull it really tight, and I'll flip, flip, and flip, because I want to tab whenever I open it. Now hit the bottom very tight, and I'm just going to tuck it under here. And that is your pack. And then I'm going to go ahead tape, and then my steam indicator tape. It has some lines on it, so whenever I autoclave it, the lines will turn black. And I'm just going to write that this was the red surgery pack because it had the red bands on it, and put my initials and today's date. And we're ready to autoclave. Okay, now I'm going to wrap my surgery gown, and I'm very short, so it's easier for me to wrap it on the table. But you could also wrap it standing up. It's just for me with making sure it doesn't touch the ground. And I've definitely cleaned my table off very well. So I'm gonna lay it, fix my camera, get a better angle. So I have it laid out. The front part is facing up, and I have my arms laid out flat. I'm just going to fold Okay, now that I have both sides folded in, it's basically inside out. So I'm going to fold it over. And now I'm going to fold it over again. And now I'm going to prep one of the Huck towels. All I'm going to do is just fold this accordion style. Half it. Half again. And flip my edge back. And then put one of my strips in here. That's going to go in my surgery gown pack. And now I'm going to wrap it. And pull this very tight. And fold the lip up. Tight. And make another lip. It's tight. Make a lip here. And pull this tight. And make a lip. And now I'm going to do the green. Fold this back and forward and back again, because I want to make my little tab. Alright, I'm just going to do the same with this. My little tab. And then I'm just going to tuck it. There's my surgery pack, and I'm going to tape it just like with my instruments, my indicator strip that will turn black. And again, my initials and the date. So I have my autoclave, and I have right now a instrument pack in there, and I'm putting my surgery pack in. And you don't want to overpack it. So I'm just closing this, and I have different options. So right now I have packs in there. So I'm going to select packs, and then I'm just going to hit the start button. And this will take a little bit, and just make sure when you open it that you check to make sure that the indicator strip looks like this. And also it'll let you know filling chamber, and then of course it gave the temperature that it's going to be at. So when you wait for it to dry all the way, and then you can also let it sit for a little bit, because when you pull it out, if you pull it out right when it's finished, it's going to be very hot even still in the pack. So I'm going to describe how we maintain our autoclave. I have the autoclave here. It is actually running right now. But I have, all the autoclaves should come with a little cheat sheet here. And what we usually do whenever we do a weekly maintenance is we have our drain tube, and it shows the door and what the inside looks like. Whenever we open it, we just kind of wipe everything down with soap, and just a mild soap, nothing fancy. And then we also make sure that the door gasket here doesn't have any broken parts to it, like the rubber's not cracked or anything. And then we also want to drain the water and then we'll wash the trays and the racks that are in there. We usually don't. These are what the racks look like. And this is if you want to make like a second layer in there. So you'll just take this out and wash it. And then we're going to refill the reservoir with distilled water. And that is the only thing you are to put in your autoclave is distilled water. For monthly maintenance, you'll go into a little more detail. And what you're going to do with that is you have this area here where it has the air filter screen, and then the vent. And you're just going to wait for the autoclave, of course, to not have been used because you don't want it to be hot trying to work with it. But you'll drain it, and then you'll fill it with water, and then you'll put the speed clean in there, which is this stuff right here. And you'll just kind of run a pouch on the pouch cycle, which will be this one right here. And then you're going to stop it when it says that it's drying. You'll stop it, and then you'll drain the reservoir and then fill it with clean distilled water. And we have several gallons of distilled water on hand at all times. Then we're going to rinse by running the unwrapped cycle, which is this one. And then at that point, we'll drain and refill the reservoir with clean distilled water. So usually we use like 2 to 3 jugs in the monthly maintenance cleaning process. You're also going to want to clean the filter screens, and you'll wait for the sterilizer to cool, remove the trays and everything, clean all that. You're going to, if you need pliers, which sometimes we don't, to remove the filter, that's also okay. You'll clean them with the speed clean, also the filters, which of course again is this right here. And then you're going to rinse them with distilled water and excuse me, and then you'll install them, and then of course it'll tell you how to do it in the manual and also here. If you've done it a ton of times, it's pretty easy. And then you'll put the trays and the racks and all that good stuff back in, and that is how you maintain your autoclave. So we're taking staples out today and just want to show how it looks really. It's very well healed. There's no red marks. Of course, one of the staples looks like it's fallen out. Okay, so I want to clip underneath. Just like that. So I'm going to hook this underneath and pinch it, and it'll just pop right out. Okay, so we're just going to take some sutures out today. Grab and then just use my and hook underneath it. And there's one. Sorry, I'm trying to do this with my left hand. I know, sweetie. I'm sorry. There's another one. Okay.